Hello everybody, it's Dr. Saydyk from Stoneridge Dental. This is our Friday video blog. I'm here in the office today working on some big cases, making the video blog and just kind of doing some business stuff. Going to go visit with a couple specialists in the area. But we're trying to think of what we could talk about today. Oh, almost forgot. Don't forget the Kenny Chesney concert coming up, our giveaway on Facebook. Don't forget, you have to like our page and you have to share our page with your friends. Put a little personal message in there telling them about the office, and then let us know that you shared our page with your friends for an entry. We really appreciate all the referrals everybody sends in. That's another way to get entries. Send your friends and family into us and get you 5 entries into the contest for Kenny Chesney. But we really appreciate everybody sharing our office with your friends and family. We really don't advertise very much. The way we can grow our office and the way I stay in business is by you telling other people about the stuff we do here and how much you and what you enjoy about our office. And also it means a heck of a lot to us too. So thanks again for being our patients. Thank you again for all the wonderful laughs and sharing your lives with us. And don't forget to tell your friends and family about our office, please. All right, so what are we going to talk about today in the Friday video log? Our video blog, vlog, is that a thing? It is now. We're going to talk about fear in dentistry. I think one of the things that we as dentists talk about all the time is every time someone meets us, they're saying something to the effect of, I'm afraid of the dentist, or no offense, doc, but I hate the dentist. My answer to that is number 1, the dentist is right here and he can hear you. Maybe not hate me yet, but I get it. Realistically, you hate coming to the dentist. No, it's nobody's top of their to-do list. One of the great passions of mine I have is to take people who are afraid of the dentist or have a healthy dental fear, because generally that is associated with somebody who has a great dental need also, unfortunately. I like to take those people and build a relationship of trust, work to get them to overcome that fear so that eventually coming to the dentist is something that's fun and joyous. So where does this fear come from? Of course, there's the obvious fear of pain and fear of needles. Teeth hurt. That's all there is. It's all that teeth feel. They feel cold and pain. They really don't feel anything else. In addition, teeth are attached to a cranial nerve. This pain goes directly to your brain. So when it hurts, it really hurts. There's no denying that whatsoever. When teeth hurt, they really, really hurt. It's nothing worse than a toothache. There's epic poems written about how bad toothaches are. So that first off is understandable. And historically, dentistry has not been as good at dealing with the pain and suffering of its patients. I think we all have a horror story. I know I have mine about when we were younger and the older dentists, and I don't want to beat anybody up, but they just didn't have the tools and techniques or the know-how that we do now. I think the other big thing about dentistry and the other big fear people have is, to be honest, it's a fear of embarrassment. This is a very private part. It's it's literally in your grill. It's in your face where we're working. It's almost like somebody looking into your bank account or budget, They see what you're really doing back there. And, you can't hide stuff from a dentist, and it's a little embarrassing. And I understand that. I can 100% understand that. And so those are some of the things that maybe keep people. And I think the third fear is the fear of cost. That's easily overcome, though. Somewhat easily overcome. It's easier than the other ones, I think, because the cost is something that just is, and the budget is something that just is. So we just have to work through that and make that comfortable. But that would be another reason people don't come in. They wait till they have insurance, or they wait until they have the money. And realistically, insurance is not going to help you out of a problem if you put it off. And money's never quite there for dentistry. We have to really make it there, unless it's an emergency, right? Then we find the money. So those are a couple of the barriers. So let's talk about the first one, and that's the fear of pain and the anxiety associated with being in the dental office. The great thing is today is we have different tools available to us to really help relieve and reduce that anxiety. I think the first thing and the biggest thing is building trust with the patients. If you trust me and you feel comfortable in my office, that's going to go a really long way to us being able to overcome that anxiety. If we don't have trust initially, really nothing's going to work. So the first thing we try to do here is keep everything nice and calm and really build a relationship of trust and make sure you understand what we want to do and you agree to everything and you're ready to go. After that, we can start using some oral medications that will reduce anxiety. We have nitrous oxide that we can use. If you want to know a great thing on nitrous oxide, look at Stuff You Should Know by How Stuff Works. It's a podcast, and they have a whole one on nitrous oxide. I thought it was fantastic. Great podcast, but go listen to that. But nitrous oxide really helps to reduce anxiety also. Having a comfortable chair to sit in, you know. We have very comfortable chairs here with nice cushy headrest. We have back support, knee support. That all goes a long way too. A blanket to keep you warm, or sometimes here's, you know, a fan to keep you cool. It really helps out, making sure you're comfortable in the chair. Some dark sunglasses so you really can't see. Headphones. I mean, just getting some music on, some calming music and stuff. There's a lot of things that we can do to help calm you down and help reduce that anxiety. Once you're anxious, you kind of ramp your system up. And now no matter what happens, even if it's non-painful, you're going to interpret that as pain and you're going to be jumping. The other thing is, I don't pack my schedule so full that I can't take time with people to make sure we have breaks and rest and to make sure that you know that you're in control. Let's talk a little bit about numbing. Everybody's afraid of the needle. I get it, so am I. There's not really a better way to get people numb yet. When there is, I will be the first one on board with that after it's been tested and tried and everything else. And I'll let you know if anything comes along. But right now, the best way we have to get people numb is using anesthetic. And that unfortunately means we have to use a needle. The needles aren't the needles of old. The needles now are very small. In addition, we have numbing jelly we put up there. In addition, I warm my anesthetic so that you don't have that cold shock. I also have a little attachment to my needle, many of you have seen, that vibrates at a very high frequency. All these things grouped together help to reduce, and my technique help to reduce that any pain you're going to feel. And most people will tell me they don't even feel the shot. It's always worse in your head. So if we use anti-anxiety medications, make sure you're comfortable in the chair, warm our anesthetic, use the smallest needle possible, vibrate it, and really let you know that you're in good hands. A lot of times, it's not really even an issue. The other part of dental anxiety would be the fear of embarrassment. That one's a little bit hard to overcome because that will actually keep you from coming in to seeing me in the first place. What I always tell people when they come in, I've had people come in and just break down in tears, just not wanting to even open their mouth, just being so embarrassed. I'm a healer. It's what I do. It's what I've always done. When I see somebody in need, I do not think judgmental at all. No one in my office does. The entire team is a very compassionate and caring team. That's who we look for. I see someone that I can desperately help. And that's one of the best feelings is when we take somebody who was not smiling, who was embarrassed, who really was it was starting to affect their lives. They couldn't go out, they couldn't do things, they couldn't enjoy life, they couldn't eat. You know, somebody that can't even smile in a picture just breaks my heart. When we're able to give that smile back and we're able to build that confidence and then they come back in and their entire personality changes, that's a huge gift. It's a huge gift that I love seeing that smile. That's what I really do work for. So when you come into our office, just know that you're not going to be lectured. This isn't the office of old where the dentist scolds you and everything. We are your coaches, we are your healers, and we are your teammates to help you rebuild your life, to help you get a healthy smile and keep a healthy smile. It's something we believe passionately about here. Anyway, there are other ways with the anxiety when we go into full sedation and a much deeper sedation. Those get a little more risky once we started getting into deeper sedation, just because you now are entering onto that pathway leading to full sedation and death. So the farther down we go in sedation, the more dangerous it gets and the more safety valves we need to have in place. I do have that capability here. I bring in a nurse that'll help do the sedation if it's something we have to do. But I really find that most people not a problem with some anxiety medications, some dark glasses, a little nitrous oxide, headphones, a warm blanket, and just knowing that you're in good hands. Anyway, that's the video blog about anxiety in dentistry. I know it probably didn't help all that much, but what's really going to help is that if you come into the office, meet with my team, meet with me, and we can talk through your particular situation and really find the right solution for you.